class. My name is Sarah Moore, and I am course lead for BSN 405, and I'm going to review Module 6 or Week 6 for you. In Week 6, we're discussing data set elements. And for whatever reason, just that term alone is scary to students. There's a link that gives a list of these data set elements. I'm just going to explain like 3 of them to you because you're going to use these 3 in your assignment 3. So NANDA, NIC, and NOC. Okay, what's NANDA, NIC, and NOC? Well, NANDA is your nursing diagnosis. So yes, we're going all the way back to your ADN and talking about care plans. So you're going to pick a 2 nursing diagnosis for this assignment. You're going to pick 3 interventions and 3 classifications. Your interventions are NIC. NIC stands for Nursing Intervention Classification, and NOC is your outcomes, your Nursing Outcome Classification. It really is that easy. So you're going to tell me about NANDA, NIC, and NOC, and you're going to describe each one of your NANDAs, and you're going to tell me about each one of your interventions and each one of your classifications. So the best example I can come up with, because I am used to work in ICU for a long time, is risk for infection secondary to pneumonia. Our ICU patients that are intubated are at risk for ventilator-acquired pneumonia, or VAP. So my diagnosis would be, again, risk for infection secondary to pneumonia. My job as a nurse is to prevent that pneumonia as best as I can. So what are some things I'm going to do to prevent pneumonia? Again, you do these data set elements in everyday practice. So what I'm going to do for this patient, my NICs, is I'm going to turn this patient every 2 hours, and I'm going to explain why I turn this patient every 2 hours. There's been research studies that show that, we turn them, we're moving the fluids around in there instead of them being stationary and fluids build up in the base of the lungs. Percussion. I'm going to do percussion for the same exact reason. I want to get that fluid moving around. I don't want it pooling down in the bases of the lungs. New research studies have shown that doing oral care every 2 hours, again, your facility might do every 4 hours, but we did every 2 hours, and we manipulated the ET tube every 2 hours, so we would move it left and right. So, and we would document which direction that we moved it into. And we did this every 2 hours with the oral hygiene, with the chlorhexidine mouth swabs every 2 hours. And in our ICU, we reduced ventilator-acquired pneumonia by 60% in a year's time. So that's huge. And per physician, we did daily chest x-rays to make sure that our interventions, our interventions were working. So why did we do, again, we did the x-rays because we're assessing what are the expected outcomes from the x-rays. Well, I don't want to see pneumonia. What are our interventions for doing oral hygiene and moving the ET tube? Well, 1, I want my patient to be able to tolerate it well, and 2, I don't want any signs and symptoms of infection, and then what am I looking for the signs and symptoms of infection? I don't want to see, yellow or green sputum. I don't want my oxygen saturation to go down. So these are some of the things I'm assessing for my patient. When I am doing percussion and I'm turning my patients, what are my expected outcomes? Well, when I suction them, I want to see clear sputum or no sputum at all. So these are how my interventions and then my outcomes. So I want my ultimate outcome is to be free from infection, but each one of my interventions, I want to see an outcome. So I turned my patient and did percussion every 2 hours. Well, my expected outcome is I want my patient to tolerate these procedures, and when I suction them, I want to see clear sputum or no sputum. I want to see, an oxygen saturation level above like 95%. When I do a chest x-ray, I want to see a clear chest x-ray. So everything is leading up to, I want to see free from infection. So I'm doing these interventions and then an assessment. So that's pretty much what you're doing in this assignment. The best way to do this assignment is to follow in order. So if you're doing your NIC, I did mine on infection, then I would probably work it through and do my NIC and NOC, and then I would do my second Nanda and then do my nicks and knocks to go with it. But again, you can do it however you want, but I think the easiest way to make it flow is to do the nicks and knocks with each Nanda. And I hope that helps you out. If you've got any questions or concerns, please let your instructor know. Hi class. Hi class.